Good day, everybody. My name is Dr. Fundi. I'm here today as part of another, new podcast, the Health Matters podcast, which deals with matters that relate to health. Health in its broadest sense, health from a physical perspective, health from an emotional perspective, health from a social perspective, and health from a traditional perspective or traditional spiritual perspective. So today we are going to be discussing a matter that it still divides people, in our country and in the rest of the world. So from the 26th of August until the 31st of August, in South Africa, according to our annual health calendar, this period is referred to as African Traditional Medicine Awareness Week. And the last day of that week, which is the 31st of August, is designated as African Traditional Medicine Day. So in our podcast today, we will be exploring various issues relating to African traditional medicines. There's a lot of misconceptions, there's a lot of confusion, and also, I think, prejudices relating to this space. And so, yes, I am a medical doctor, but with a special interest on matters of traditional medicines and how that can actually add value in terms of the health of the people of this country and the world. So welcome to you all, and let's zoom into it. I've got my colleague, Mr. Sipho Masiho. He will be asking questions that will elicit responses from me in relating to various aspects of this topic. So, Mr. Masiho, welcome to the Dr. Fundi channel, the Health Matters podcast.
Thank you very much for having me, Doc. I'm excited to be here to speak about this very important topic.
Thank you very much. And let's not waste any time. Let's get ahead with the topic.
Absolutely, Doc. So, Doc, when you told me about this very important week, there's some couple of things we discussed, you and I. So I wanted to just find out from you, Doc, what is the traditional medicine as per the World Health Organization,
yes,
as well as the THP Act, which is the Traditional Health
Practitioners
Act.
Yes.
So please explain further, Doc.
All right. I think it's very important when you are discussing any topic, especially if there is, confusion or controversy around that topic. It's important to define it before, it's important to define it before you actually talk about it. So let me, get into the definition. Now, we all know that the World Health Organization is the custodian of all matters of health in the world. And South Africa, is a member country to the World Health Organization. We sometimes take a cue from the WHO as to what must happen on matters of health. We remember during COVID, we took a lot of guidance and leadership from the WHO on how the country should respond on matters of COVID. So even on matters of traditional medicine, we follow some of the guidance from the WHO. So to answer your question specifically, according to the World Health Organization, traditional medicine is the sum total of knowledge, skills, and practices that are based on theories, beliefs, and experiences indigenous to different cultures that are used to maintain health, as well as to prevent, diagnose, improve, or treat physical and mental illnesses. Now, just to clarify also, if a traditional practice or traditional medicine from a particular country gets to be adopted in another country, then we sometimes don't refer to it as traditional medicine in that sense. We say it's alternative or complementary medicine. So, but traditional medicine is based on theories, beliefs, experiences that are indigenous to the different cultures, and they are used to maintain health as well as to prevent, diagnose, improve, or treat physical or mental illnesses. But let me also get into an act of parliament that was passed in 2007 here in South Africa. It also defines, what this, traditional, medicine is. And I think it's important to just, refer to the definition there. Now, according to the definition of traditional medicine as per the Traditional Health Practitioners Act 22 of 2007, it means an object or substance used in traditional health practice to diagnose, treat, or prevent physical or mental illness, or any curative or therapeutic purpose, including the maintenance or restoration of physical or mental health or well-being in human beings. But this does not include a dependence-producing or dangerous substance or drug. Let me just go further. According to the same act, in terms of the philosophy, traditional philosophy, it says, it means indigenous African techniques, principles, theories, ideologies, beliefs, opinions, and customs, and uses the traditional medicines communicated from ancestors to descendants, or from generations to generations, with or without written documentation, whether supported by science or not, and which are generally used in the traditional health practice. So that is what comes from our act, the traditional medicine definition and the traditional philosophy definition. Now, it goes further again, talking about traditional health practice. It means the performance of a function, activity, process, or service based on traditional philosophy that includes the utilization of traditional medicines or traditional practice, and which has as its object the maintenance or restoration of physical or mental health or function, or the diagnosis or treatment or prevention of physical or mental illness, or the rehabilitation of a person to enable that person to resume normal functioning within the family or community, or the physical or mental preparation of an individual for puberty, adulthood, pregnancy, childbirth, or death. But it excludes the professional activities of a person who is, registered under other acts. That is for pharmacists, for medical doctors, for nurses, and all of that. So I've just given you a broader definition so that we are very clear that we have an act of parliament in South Africa, that actually recognizes traditional healing, and within that traditional healing, there is an aspect of traditional medicines that are used. So I hope that provides a good foundation for people to understand that traditional healing and traditional medicines are actually here to stay based on this, Act of Parliament. Prior to this Act of Parliament, which was in 2007, when it was signed into law, traditional healing or traditional medicines were actually outlawed in our country by the previous colonial and apartheid governments. In 1953, there was an Act of Parliament which is called Witchcraft Suppression Act. So they actually included issues of traditional healing and traditional medicines as part of witchcraft. So if you practiced traditional medicine or you went to consult a traditional healer, you could be found to be on the wrong because it was suppressed under that Witchcraft Suppression Act. Absolutely. But also the Health Act of 1974 also outlawed people consulting traditional healers. So the new act from 2007 therefore gets rid of that that stigma that was created by the Witchcraft Suppression Act and the Health Act of 1974. So we are now in a country that respects the cultures of all the people of South Africa, including the choice to decide where to go to seek professional help.
Absolutely. So why are we celebrating this week, Doc?
So it is very, very important. I've just given you a history of how the previous colonial governments and the apartheid governments outlawed this, indigenous form of healing, or what we call traditional health practices. So it is important that we celebrate, because this is our heritage. This is our heritage that is based on our cultural beliefs. This is based on our cultural philosophies. But more importantly, and I'm sure we'll deal with this a little later, South Africa is blessed with a lot of indigenous plants that are unique to this country, that have got medicinal properties or healing properties. And by outlawing this space, we've actually been deprived of an economy that's related to the wealth of indigenous plants with medicinal properties and other properties. Yet countries like China and India and Brazil are actually reaping benefits because they recognize this. But we'll talk about this a little later.
Absolutely. Doc, before we continue with our conversation, there's a traditional healer who sent us a voice note.
Wow.
Yeah. Okay. I thought maybe let's hear from him how he feels about the whole celebration of traditional medicine and what this day, the 31st of August, really means to him. Let's take a listen to him.
Thank you.
Igama lami ngutsheluyise wakasithole ngiyinyanga. The 31st of August is an African Medicine Day. This is a day where I celebrate as a healer. I celebrate because of my gift is recognized by the rest of the world. My gift is still recognized by the big organizations, which says to me that bongasi impazamo ukuthi ngibe inyanga. You see, this day is a day where we as healers have a center stage where we showcase the gift given upon to us by the Almighty. This day is a day where we show as healers the art of healing with African medicines. From counter millennia, you can actually go as far back as about 1800. We have been using African medicines, and it is through these African medicines that we were able to give birth. Uthola aboma bakwazi ukuzalisa ngokuphuza umbola. Uthola umuntu ukuthi kade agula ngeenkathi zayizolo will use, for example, umabophe to actually heal him or her. So this day is a day I as a healer celebrate because of it shows that isintu angeke sambe siphele. Umuthi wesintu wase-Africa is given to us by uMvelinqangi to heal each other. So as a healer, I celebrate this day because of it shows that my gift will never cease to exist. So now, I sing beautiful songs to the Almighty ngokuthi kahle kahle ngiyinyanga. Ngiyinyanga onolwazi lwesintu sase-Africa. African Medicine Day, I pray ukuthi ingapheli. It continues because of isintu sasekhaya kwamele siqhubeke. So now, there are other organizations which will disregard or discredit this knowledge of African medicine because of they will tell you that ayikho clinically tested. There are no clinical trials which will prove a certain medicine like uspephetho. But now this indigenous knowledge which was given to us upon our ancestors, ayipheli. So now I sing I sing beautiful songs ezokuthi ayiqhubeke lento. Happy African Medicine Day. Let the knowledge, let the healing continue. Magwande, Thokozile.
Thokoza.
Cool.
Thokoza. I am so warmed, inside by that message. Because I don't even need to add anything to it. It
Yeah.
is so clear. This is somebody who's very proud of the indigenous knowledge that, I'm not sure it's a he or a she.
It's a he.
It's a he. He's very proud of the indigenous knowledge that has been passed on for generations. Obviously, he credits God because one and other mistake that people believe when it comes to African spirituality, they think that African spirituality has got no God. It's about ancestors. It's a very, very big mistake. Africans, long before people came here with other religions, have always believed in the presence of God. Different ethnic groups with different languages gave a different name to that God, but it's the same God. In my language, Xhosa, we called it Kamata.
Kamata.
Yes,
Okay.
in my language. In Zulu, Mveli Ngangi. All right?
Okay.
All right. In Sotho, there's also, Mudimu, and different cultures, have a different name, but it was about the same, supernatural being. But what Africans did in terms of their African worldview was to also then say, there is this big person up there who is always looking to, help us as we navigate life. But you interact with that supreme being via intermediaries. And those intermediaries are the ancestors. That is, people who have walked this earth before you, who have since passed on. But they are referred to as the living dead, the ancestors. They are living spiritually, they are dead physically. And those people, they exist once they transitioned from earth to the other realm of spirituality. They become active, advocates and agents of their offspring and the whole generation after them. In terms of the issues, of health, wellness, fortunes, and other things. So they are supposed to be constantly, advocating for the interests of their lineage in the new realm. So this person has actually spoken about the gift from Velingang. But that gift goes via the ancestors to him in this earth. Very, very important. And so people do not, pray to ancestors. People don't worship ancestors. People worship Mvelingangi. They worship Kamata. They worship Mudimu. They worship God. But it is the middlemen that differ. In African traditional medicine, the middlemen are the ancestors. That is your blood, forefathers. In Christianity, the middleman is Jesus.
Yes.
Who is an ancestor of the Jewish faith. And in Islam, they still worship, Allah, all right, which is the supreme being. But the middleman, is Prophet, Muhammad. So that's where the difference is to who is the middleman to advocate to the top. So I think it's important people understand that African spirituality is not about, worshiping ancestors. It's about worshiping God via a different intermediary.
Absolutely, Doc. So how widespread is the usage of traditional medicine, not only in SA, but in the rest of the world?
Very important question. Very, very important question, Sipho. Now, you heard me earlier saying there were suppression acts, Witchcraft Suppression Act in South Africa, and Health Act of 74. But globally, as per WHO, in some Asian and African countries, about 80% of the population, they depend on traditional medicine for their primary health care.
80%?
80%,
Yes.
right? this is from WHO, an estimated 70 to 95% of citizens in the developing world are using traditional and herbal medicines to address their primary and secondary care management of their healthcare needs and concerns. In sub-Saharan Africa, of which we are part of that, the ratio of traditional health practitioners to the general population is approximately 1 in 500. That is, for every 500 people, you've got one, traditional health practitioner. However, when you look at the ratio of biomedical doctors or Western doctors like me, the ratio is for every 40,000, people, there's one Western doctor. So you can already see there that in numbers-wise, there is more traditional healers in our population compared to biomedical doctors like me. And so, as a result, when somebody has got a health challenge, it is easiest for them to actually go and see a traditional health practitioner.
Because it's closest to
closest, and they speak the same language,
Yes.
they share the same culture, and they have got time for their patients.
Yes.
We as medical doctors, biomedical doctors, we don't always have time with our patients to understand their challenges. Number one, because we are normally inundated with patients, and we've got volumes that we need to push. We don't often share the same language and culture to understand certain nuances on matters of health. So the answer really, majority of people, especially in developing countries, including our own country, they believe in traditional healing. And as a master's student, in the late 90s, I chose a topic about the prevalence of use of traditional healers, by urban blacks. And I wanted to see if actually what I had, been told is actually true. In my study, I had 100 patients from my practice that I had to survey. And I actually confirmed that almost 60% of the people that responded to that survey were consulting traditional healers, and they believed in the ancestors as the transition to or the middleman to God above. So globally, the majority of people, but through the acts and other things and prejudices, sometimes people do not openly admit to the use of traditional healers. But the truth is the majority of people, especially in the developing world, as in South America, in Africa, in Asia, they believe more in traditional medicines than they do, with other forms of healing.
Doc, you spoke earlier on about the THP Act. Who does it really cover? Because the traditional medicine space, I think it's quite broad. Yeah. Are there limitations to it? Are there specific people that are being covered by it?
Yeah. So according to this Traditional Health Practitioner Act 22 of 2007, this act applies to traditional health practice in the Republic. Right? It covers traditional health practitioners and students who are engaged in or learning the traditional health practices. Let me, be much more specific. There are a number of practitioners that are actually, included in the Act. Now, just a bit of a definition. A traditional health practitioner means a person registered under this Act in one or more of the categories of traditional health practitioners. Now, the first practitioner is the diviner. Yeah? The diviner or isangoma. In Xhosa, igqirha. All right? This is a person who engages in traditional health practice and is registered as a diviner under this Act. So this is somebody who has an ancestral calling to become a healer. Okay. All right? And once they accept that ancestral calling, then they undergo a practice called ukuthwasa under a professional, and then they qualify as a fully fledged, isangoma or igqirha. So the diviner, that's the first group. The second group is what we call herbalists. All right. These are people who engage in traditional practice and are registered as herbalists under the Act. Again, these are people with deep knowledge about, indigenous plants with healing properties. Usually, this is knowledge that is passed from father to a son.
There's no calling, yeah.
There may or may not be.
Okay.
There may or may not be. But these people, sometimes you get a double calling. I mean, to be a diviner, but yet also have, the deep knowledge about the healing plants.
Okay.
All right. So deep knowledge about the plants or the herbs that are used for various, for their various healing properties. All right. And this is an area that we are sitting on top of. We've got so many indigenous knowledge holders about these healing herbs, which we are not activating as a country. Then it's traditional birth attendants. These are the people who were more like the obstetricians in the past.
Oh.
Yes. So whenever a woman is about to deliver, they would be the ones who are called to assist with the delivery. They had deep knowledge on how to make sure that a delivery is done successfully, and deal with whatever challenges that come, with the delivery. For example, a child can come as a breech. A breech is when they come with the back instead of coming with the head to come out. They had a way of how to turn those babies around so that they come out with the head, and not the back. Otherwise, when they come on the back, then they may suffocate and die inside. So we had these people with this skill long before, modern medicine came around. So they are recognized by the Act. There's traditional surgeons, circumcision surgeons, who are also recognized. Where I come from in the Eastern Cape, they are responsible for conducting the circumcisions as the boys transition, to being, a man. And then they are the traditional tutors, that is, those who already are qualified as traditional healers. They are covered, including their students, what we call, traditional healing students. So those are the people who are covered by the Act.
So, Doc, just going back to one of the things you spoke about, that during the dark days of apartheid, there were laws that actually outlawed traditional practice.
Yes.
How effective were those laws? Did it stop people from using umuti?
Yeah.
Yeah.
Well, I call you Tasiga at times.
Yeah.
So Tasiga, these are the laws that were just good on paper. In reality, they meant nothing to the majority of the people. They were ignored. They were ignored because they were meant to suppress what is part of who we are. Who we are in terms of tradition, who we are in terms of culture. All right? So people just ignored them. What people did, though, was to do this discreetly in some instances, especially those who are more learned, like me, would go and see traditional healers
at night,
and not do it publicly.
Not
so
be
they
seen.
do it discreetly. Yet other people in the deep rural areas, they had no issues in going to see traditional healers at any time of the day or night, or even have them presiding over rituals in their homes, So that is the situation. So those acts actually failed. In fact, what we had up until this new act was a parallel health system. All right, a parallel health system in South Africa where one side was traditional healing, which is used by the majority of the people.
Absolutely.
On a day-to-day basis.
Yeah.
And then you had the biomedical or the Western health system that is used, and it has always been, officially, recognized. But there was little interaction between these two in terms of as systems. But the people on the ground would actually use both of them, sometimes at different times, sometimes at the same time. I mean, one of the things that triggered me to actually do my master's research on this topic was because as a practitioner in Port Elizabeth, running my own private practice, and also here in Gauteng, in Boksburg, Vosloorus, I would have patients coming to me after they had gone to see traditional healers.
Yeah.
Sometimes they will see me and then go and see traditional healers. Or at times they would actually use both of us at the same time. And it used to fascinate me, Wuti. Why? Why am I a bad doctor? Why would somebody, after getting a 5-star service from me, they go and see a traditional healer?
Yeah.
But when I started, researching and learning about this space, I realized that the work that I do as a biomedical doctor does not always answer the question that a typical traditional African has. And the question is, yes, doctor, I've got TB, yes, I've got HIV, yes, I've got high blood or diabetes. Fine, I hear you, doctor. But why me? And why now?
Which is something...
All right? Why me and why now? Now, if you go back to what I said about the ancestors, the living dead, are supposed to be advocating and protecting you. So there shouldn't be an illness or a disease or a misfortune that befalls you if they are doing their job. That is the African worldview.
Okay.
Yeah. So when somebody has got an illness or an injury or a misfortune, they are being retrenched. They are asking, why me? And why now? Right? They are saying, my people who are supposed to be advocating for me, where were you? Why did you allow this to happen? Are you on a go slow? Or are you actually on strike? That's why these things happened to me.
Yeah.
And so when they leave my practice after the diagnosis and go and see the traditional healer, it's because they're looking for an answer that I, as a biomedical doctor, cannot answer in terms of why me. Now, a Sangoma has a skill of being able to activate their own ancestors, to engage with the ancestors of that particular patient, so that they can get the answer from those ancestors as to what is it that they may not be happy about that has made them to be on a go slow or even on a strike. You see. So I think that's how to simplify this matter. So those acts were actually useless.
Absolutely. Doc, going back to the WHO again, so what is their attitude in relation to the practice of traditional medicine within their member countries?
Well, I must say that WHO has actually been quite, supportive of the use of indigenous healing systems or traditional medicines or traditional health practices. A few years ago, they had a congress, a WHO congress, where they actually discussed this matter, and they came up with a policy. And their policy was WHO and its member states, they are going to cooperate to promote the use of traditional medicine for healthcare. They saw this as a collaborative effect, and the aims of the collaboration was to support and integrate traditional medicine into national health systems in combination with national policy and regulation for products, practices, and providers to ensure safety and quality. To ensure the use of safe, effective, quality products and practices based on available evidence, and to acknowledge traditional medicine as part of primary health care, to increase access to care and to preserve knowledge that is, in indigenous knowledge systems and resources, and to ensure patient safety by upgrading the skills and the knowledge of traditional medicine practitioners. Now, this is at the time of Dr. Margaret Chen, who was the, I think, first female Director General of the World Health Organization. And she actually said, let me begin with the current reality, which on at least one level is quite straightforward. Traditional medicine is generally available, affordable, and commonly used in large parts of Africa, Asia, and South America. For many millions of people, often living in rural areas of developing countries, herbal medicines, traditional treatments, and traditional practitioners are the main and sometimes the only source of healthcare. This is the care that is close to homes, accessible and affordable. In some systems of traditional medicine, such as traditional Chinese medicine and the Ayurveda system. Now, traditional Chinese medicine, that's China. Ayurveda system is in India. They are historically rooted, in the cultures and the traditional practices that are supported by the wisdom and experience that has been acquired over centuries in those cultures. So in these contexts, when traditional medicine has strong historical and cultural roots, practitioners are usually well-known members and respected members of community who command the respect and are supported by the public confidence in their abilities and remedies. This is the reality, and this form of care unquestionably soothes, treats many ailments, reduces suffering, and relieves pain. This is the reality, but it is not the ideal. So I hope, from what I've just shared with you, it gives you a sense from the highest level at DG of WHO what the thinking of WHO is as far as traditional health, or traditional medicine.
Doc, it explains a lot that from the high level and from South Africa's acts or parliament level that this has been approved as a practice.
Yes.
But now there's still skepticism. There's still opposition from professionals and people in society and professionals in the healthcare space who are moving very slow in putting this act into practice.
Well, let me start by saying, though, the Traditional Health Practitioners Act, which came in 2007, the primary purpose was to be able to regulate this space. Because the act is good, it's approving or it's recognizing. But the next thing was for this to be regulated. So an interim traditional health practitioner council was set up as a part of this act. Right? Now, from a law, you need to have regulations. And those regulations must then be developed by, that sector. So a traditional health practitioner interim, council was set up, reporting to Department of Health, National Department of Health. Their duty was then to put in place various regulations of who is a traditional healer, what kind of licensing powers they must be given, who is a GP, who is a specialist amongst them. I'm just talking, to simplify things. But basically, what kind of training, under who can issue a sick note and who can't, all of those kind of things. So unfortunately, the term of the first interim council ended before they could come up with the regulations. So there was a vacuum for a bit of time. A few months ago, they have inaugurated a second interim council, right, which is supposed to then continue from the work that was done, because it's difficult for this to be operationalized before the regulations are there. For example, in the public service, the policies that have to talk to illness and treatments and who issues a sick note, they are quiet. And therefore, the employer is faced with a situation where somebody brings a sick note from a traditional healer. But they cannot accept it because the policies of government, at a DPSA level, public service and administration level, are not yet in tune with the Act. But the Act cannot be operationalized because the regulations are not yet there. So there's been some delays. But there are challenges, So a lot of people, because there are no regulations as yet, or others because of prejudices, they still shun this form of traditional healing. And for those who are health practitioners like me, who have worked in hospitals or continue to work in hospitals or in their own medical practices, they have a challenge because they have been, told about how bad traditional healing is. And maybe when they are working in hospital, they've seen 1 or 2 patients who came with kidney failure or liver failure after having used traditional medicines. But that is 1 or 2 patients out of how many thousands of people who consult these guys on a daily. So, but yes, so there are some strong views from some of the health professionals, even within my space, who don't want to hear a thing. Unfortunately, that they're going to have to change their mindset, because the traditional healing is here to stay. And collaboration is what the Act is looking for. And in some instances, there are good stories to tell where there has been collaboration between traditional healing and Western medicines. So we need to open up our minds. We need to learn. And what has been found elsewhere in the world is that whilst it is difficult for orthodox or biomedical doctors, or Western doctors like me, to accept traditional healing, what has been found is that it's the opposite with traditional healers. They are always open-minded most of the time to embrace new information from the Western side. For example, when HIV came, at that time, they used to use the same blade to do the traditional scars on different patients.
Abo 11. So
yes, Abo 11. Yeah. But, they used to do that using the same blade. But when they were given information that you may spread HIV by using the same blade, they were able to accept that and adopt a new practice that bring your own blade.
Oh, yes.
Yeah. So they have modified their practice based on new information. But the alternative, on the other side, of medical doctors adopting some information or practices that are coming from the other side, it's very difficult. We think we are superior based on our Western biomedical knowledge, but there are conditions where traditional healers have been found to be superior in the treatment of patients compared to us. In the area of mental health, for example, they have been demonstrated that some people who present as psychotic patients who are put on medicines don't respond. The symptoms may be contained a bit, but they don't really respond in a sustainable way. Yet when those people then undergo the practices like ukutwasa, those symptoms that were distressing them no longer cause a distress, actually become a tool of the trade. So I'm just trying to say that we need to open our minds. A lot of research is taking place outside of South Africa, but also within South Africa in this area. And I'm glad that I'm one of the people who's following the developments in that space.
Absolutely, Doc. So just on that point, I'm trying to find out that do you see it happening in our lifetime, the collaboration?
It's happening already.
Okay.
It's happening already. So to give you an example, I'm trying to do another postgraduate qualification, but things have just been slow, a PhD in this area, but things have been a bit slow.
In traditional medicine?
In psychiatry, but my topic is around mental illness and African spirituality. There's been research done at UKZN on this area, and part of the findings there, from these 2 studies, Amatwasa 1 and Amatwasa 2 studies, there's also another study that is done with collaboration globally, but I'm not sure about the findings about that one. But the other 2 studies, Amatwasa 1 and 2, they actually say some of the people who present, because they looked at what we call first episode psychosis, those people who are presenting for the first time with, psychotic features, hallucinations, delusions, and all of those things, who are out of touch with reality. So they looked at those people And part of what they've found is that at least a quarter of those people, the actual psychosis is as a result of an African spirituality issue, the ancestral calling, a quarter. And once those people have undergone the training, then the symptoms that were distressing them actually becomes the tools of diagnosis, because now they can be able to engage with their own ancestors and their patients' ancestors and be able to diagnose and advise what needs to happen. But it's still early days. Like I say, there's another study, that is being done that is global. I'm not yet in touch with how it's going. What's interesting is that outside of South Africa, people are actually researching the space. There is a doctor who used to head a department at the University of Natal Medical School, who is now, I think, in Holland, working in another university there. He is doing a lot of work with the local, university, of KwaZulu-Natal, collaborating with people there. Now, prominent traditional healers like, what's his name now? Babu Mkhize, man. He used to be in Radio Zulu long time ago.
Okay.
He's got an institute of traditional medicine, and he's now collaborating with the University of KwaZulu-Natal Psychiatry Department, in terms of research. So what I'm trying to say, and there's also a deputy vice chancellor at the University of Natal, UKZN, Prof. Mkhize. He also has got, close working relationships, with traditional healers across the length and breadth of KZN. And so, being an academic and a researcher, he and the Department of Psychiatry are actually reaching out, and they are establishing bridges, between academia, and also, traditional health. So what I'm trying to say is there are established collaborations already, and those are needed. In the area of medicines, the traditional medicines, again, another unit that is led by another professor, Professor Nceba Galeni in the UKZN, is collaborating around, these medicines. In the Free State, a pharmacist who is now, someone's got a PhD in pharmacy, Professor Matsabisa, Mutlalebule Matsabisa, is doing a lot of good work, collaborating, and researching this area of African medicines. Also, Northwest University is doing great work in this place, and also University of Venda. So I'm just trying to show you the collaborations that are taking place. And Professor Matsabisa that I've just spoke to you about, he's one of only 9 people in the world who was invited as the WHO was actually going to have their first summit on traditional medicine, which took place about a week or so ago in India, to see how to advance traditional medicine. So who are we in South Africa to actually close our eyes to what is happening globally? And so I'm happy that even though we still have mixed feelings about this space, some of our experts in the various universities are actually doing work on the ground. So in our lifetime, it is happening, and more of it is going to happen.
Absolutely, Doc. We've got 10 minutes to go, Doc. I've got 2 questions left that I really want to ask you, Doc. You spoke about this earlier on. It's the economy of the traditional medicine in South Africa. that we're actually not looking at it as an economy of its own.
Yeah.
Yet the BRICS countries are really using that as an economy of its own. How can we get to that level?
I think let's start by saying South Africa is blessed with a lot of these indigenous herbs or medicines, with different benefits, nutritional benefits, what we call nutraceuticals, nutritional benefits, pharmaceutical benefits, that is the healing medicinal benefit. Others actually have been used for ages to deal with various problems affecting the skin. We call them cosmeceuticals.
Okay.
Right. So we are blessed as a country. Now, I mean, if you go to Kirstenbosch Gardens outside of Cape Town, where they keep all our plants, and all of that, there is a section there, a big section in Kirstenbosch, that is a section on indigenous plants with healing or medicinal properties. So do yourself a favor if you go to Cape Town, visit Kirstenbosch, you will see this. Now, the painful thing, though, is that with all of these riches that we have, and we're in the top 5 in the world in terms of those riches. Brazil, the Amazon area has got a lot of these healing plants. And the shaman people in South America, they are leveraging those and actually doing something good in terms of turning them into, medicines that can actually be sold in pharmacies and all of that. So they have the most. In Africa, DRC is the richest when it comes to this kind of plants, the Congo Basin, that area. South Africa, I think, is the second most in the continent, but worldwide, I think we're in the top 5. Where do I get this information from? Somebody who is a researcher in this place. There's a doctor called Dr. Onk Chabalala, or Supeka Chabalala. He's not a doctor of medicine, but he's got a PhD, and this is in the area of interest. He is now a director of the Indigenous Knowledge Systems Innovation Unit, at the Department of Science and Innovation. His responsibility is to actually grow this space. And he does a lot of work with traditional healers. He refers to call them indigenous knowledge holders.
Okay.
Right? In the communities. And they are doing a lot of research working with those communities, that is the indigenous knowledge holders. Now, he's had a resistance at the beginning because people came and stole that knowledge, in the past. People from outside of the country, the very people who had outlawed, this practice. So he's had to build trust with these knowledge holders so that they can trust the process of how to take these indigenous medicines, put them through research to show effectiveness of the of those products, and also how to then take it to the next level of product development. Once products are developed, the safety standards and everything, moving to the point of how to actually make production facilities for these medicines, and how to then help those knowledge holders to be able to use those products and develop businesses, entrepreneurial businesses, how to package, and how to enter them into the market. They're doing great work in that area. Producing nutraceuticals, producing pharmaceuticals, producing cosmeceuticals, out of those products. Now we need more of that, because now those people, their IP, intellectual property, has been captured as theirs, so that they will always benefit from those medicines. So what I'm trying to say then is that we need more of that. The thing that has been stopping us from not leveraging is one, obviously, the historical things of prejudice against traditional medicines. Number two is the lack of scientific research. Because if, for example, I'm looking at Mpesu, you are guys, you know Mpesu. Mpesu is used as an aphrodisiac.
Yeah.
There must be some active ingredient in the Mpesu that actually does what, the blue pill does.
Yeah.
I'm assuming you guys know what the blue pill is.
No, we do.
Yes.
We've never used it, but yeah,
You don't have to say it in public. We don't know. So the active ingredient in Viagra, I think it's called sulfinadine or something like that.
Okay.
So you need to isolate the active ingredient within Mpesu.
Okay.
So that then it can be, the other impurities in that plant are taken away. And then you make tablets from the active ingredient. You can then say 100 milligrams, 20 milligrams, whatever.
Okay.
You understand?
Yes.
So what traditional medicines lack is the research to actually pick up the active ingredient that can be given in a way that is safe and not have complications from those medicines, which may come from the impurities.
Yeah.
You see, so that's where we lack. But our government, through DSI, is starting that process, but it needs to be done in a bigger scale. Provinces need to invest. There's a lot, just like now, there's a blowing up of companies that are taking advantage of the legalization of DACA to do medicines that are DACA related. We need exactly the same when it comes to the various, traditional medicines in South Africa. China is doing a lot in terms of contributing to this space, billions of dollars, hundreds of billions of dollars from traditional medicine. If you go to China now and you want to study medicine, you have to decide whether you want to study the Western biomedical medicine or you want the Chinese medicine. They've got universities, So Professor Matsabisa is now collaborating between Free State and the Beijing University of Chinese Medicine. We have not even started here to have tertiary education levels, where somebody can actually do. Luckily, Northwest University has just started a 4-year course in indigenous knowledge, system. That is Northwest University. It's the first in South Africa where you do a 4 years and you get a degree in indigenous knowledge, which will include this area. But in general, we have not leveraged these riches in terms of the plants, and we need to research, we need to produce factories, we need to promote, we need to ensure safety, and the government must continue to support this. Then we will be able to, we are struggling our economy, yet we're sitting on top of these riches. And we need to, get our country to benefit from the wealth of knowledge that we have.
Absolutely. Doc, I think you've answered all my questions, and I'm very happy with that. Very interesting indeed. I don't know if you have, you've got a minute just to close off our conversation, Doc.
No, I think we need, as a country, as the people of this country, to decolonize our minds as far as the issues of African spirituality, and that also includes, the traditional health practices that are linked to African spirituality. The majority of our people actually believe in traditional medicine, the various forms of it. When somebody gets promoted and becomes a CEO, they quietly go home, slaughter a sheep or slaughter a cow to say thank you.
Yeah.
That already is traditional healing. You are connecting your fortune to saying these guys played a role in them engaging and advocating to Mveli Ngangi.
Yes.
But we don't want to accept that. It happens all the time. I go home to Mtata to slaughter, to say thank you for a good year. How many people who are top CEOs and top whatever, they do it. But certain aspects of traditional healing we look down upon. So let's open up our minds. Let's decolonize our minds. Let's actually take advantage of what our culture has given us and what makes us unique. Thank you.
Thank you very much, Doc.